Let's have a look at the muscles of facial expression from a lateral perspective. We have the occipital belly of the occipitofrontalis. This is the epicranial aponeurosis, which connects the occipital belly of the occipitofrontalis and the frontal belly of the occipitofrontalis. Alternatively, we can also just call them frontalis and occipitalis. That kind of makes just as much sense in my mind. We have muscles associated with the ear, so they're called auricular muscles. Here's your Orbicularis Oculi. The large ring part here is going to be the sphincter that helps pinch your eye closed. Okay, and in addition to that, you also have a smaller part, the one on the eyelids, which is the palpebral part. We have our zygomaticus major, and close by the zygomaticus minor, we have the buccinator or buccinator, however you would like to pronounce it. I've heard it either way. You have the sphincter around the mouth named Orbicularis oris, the depressor of the lower lip, depressor anguli oris, and the depressor of the angle of the mouth was that, and this is the depressor of the lower lip, the depressor labii inferioris. If we move this a little bit further over here, I can also see a muscle, which we're going to deal with actually in the next segment, but this large muscle here is the so-called masseter. And the large gland here is the large salivary gland that we have, which would be our parotid gland. If I rotate this a little bit like so, we can see here's going to be another gland. This would be your submandibular gland. Submandibular gland, parotid gland, masseter muscle. The innervation for the parotid gland actually stems from the glossopharyngeal nerve, cranial nerve number 9. The course, how the fibers get to the gland, is quite interesting because the parasympathetic fibers will travel via branches of V3, via branches of the auriculotemporal nerve, to the parotid gland. The parasympathetic synapse will have occurred in a small ganglion named the otic ganglion. The other gland you can see down here, the submandibular gland, and there's another one called the sublingual gland, those will actually have innervation stemming from a different cranial nerve, which would be from cranial nerve number 7. In that case, fibers hitch a ride via a special little branch called the chorda tympani that then joins the lingual nerve, which is a branch of V3, and synapse in a ganglion called the submandibular ganglion. Here's something interesting about the buccinator muscle. The buccinator actually originates from a region called the pteriomandibular raphe, which is basically a fibrous line where two muscles meet edge to edge. In addition, it also originates from the alveolar process of the maxilla and mandible. The buccinator inserts into the lips, where it intermingles with the Orbicularis oris muscle. The buccinator is an important muscle because without it, it would be hard to keep food between the occlusal surfaces of our teeth. Imagine you're like blowing air into your cheeks. You kind of make like big cheeks like Louis Armstrong, but you can also suck in your cheeks, right? Well, if we weren't able to push food from the our cheeks back into the occlusal surfaces or in the gap between our maxillary mandibular molars, we would have a lot of food just hanging around in the little vestibule, which is between your buccinator and the teeth and the gingiva on the inside of the mouth. Something very important to note, though, is that the buccinator is not a muscle of mastication, right? It is important in eating, but it's not a true muscle of mastication. Rather, it is counted as a muscle of facial expression, which is also used in smiling. And the next muscle, although it's quite skinny and thin, is also considered a muscle of facial expression, which is your platysma muscle, which you can see over here. Let me see if I can highlight it for you. And here you go. Well, and if you look down here in the region of the pec major and the deltoid muscles. Well, this is going to be where the platysma originates, specifically actually from the fascia that is overlying the pec major and the deltoid muscles here. It'll insert all along here, along the inferior border of the mandible, but also along the parotid fascia, because don't forget, right here covering your masseter and, well, your ramus and angle of the mandible is going to be your parotid gland. So if we contract the fibers of the platysma, you can probably deduce what's going to happen just from looking at the fiber direction. Yes, it's actually going to assist in depressing the angles of the mouth and the mandible, and as it's a muscle of facial expression, no surprises here, this is going to be innervated by the facial nerve, specifically from a little branch which comes straight down here, which is called the cervical branch of the facial nerve. The arterial supply is from the submental artery and the suprascapular arteries.